I would like to respectfully invite Dr. Mukesh Chawda. And before his speech, I would like to respectfully read out his short profile. He is a Senior Manager of Healthcare Services at Solomix Herbaceuticals Limited, India, and he is also a clinician with a successful track record of over 25 years. And with his inclination and expertise in research, Dr. Chawda has been a co-researcher in activities in Dhootapapeshwar Limited and Solomix Herbaceutical Limited. So Dr. Mukesh Chawda would present some fascinating insights on revalidating efficacy and understanding the mode of action of Rasaushadhi. It's over to you, sir.
Namaste, Aivo and everyone. I'll be very crisp, very precise, and some important message. We have heard many speakers. It started with the keynote speech. What he emphasized was safety is very important. Then Dr. Suhas Shetty sir and Dr. Mahesh Thakur sir, they are all successful practitioners. He said that products should be safe because our reputation of the practitioner and also of Ayurveda is at stake. So now this responsibility, the first responsibility comes to the manufacturer, because we are manufacturer, we should ensure that we deliver safe medicines. So I want to give some examples today that the usage of Rasaushadhis, herbo-mineral medicines is increasing. But what is our approach? When we, as a manufacturer, Shri Dhootapapeshwar Limited, the first and foremost thing which we believed, and we believed it 150 years ago, because we have completed 153 years or 152 years. See, what we are lacking is evidence, because this is an era of evidence-based medicine. We say we have to turn the tide. We should shift from the belief system to relief system. When we talk of relief system, we have to give evidence that our products are safe, our products are effective, and we also know how our products work. Now, when we talk of mode of action, what is our SDL approach? SDL is Shri Dhootapapeshwar Limited. We say, we should understand the text first. We cannot combine 4 or 5 ingredients and launch a formulation. Because I appreciate Mahesh Thakur sir. He said that everyone should have Rasa Tarangini. Now see, it starts with reading the text. So first we should understand the text. We have a team of say 50 Vaidyas working at Shri Dhootapapeshwar Limited. So it starts with reading the text. I joined as a technical officer. My colleague, Dr. Kiran, he is there. He also joined as a The first job which is given to us is we are library in charge. We have to take care of books and we have to read books. When we talk of understanding treatise, then we launch a product. Whether it's a product like Bhasma, which is an classical formulation, or a product like Amlapitta Mishran, which is an proprietary formulation. Then we develop a product. When we develop a product, we know what we are giving. So we have to characterize or standardize the product. And we have an in-house repository where we have developed Shri Dhootapapeshwar standards. We know what we are offering the patient or to the Vaidya. Then comes preclinical efficacy and safety. We do lot of experimental studies, we launch or we do some publications. After ensuring that it is safe, this is an example of Bhasma. We have also proved that it is non-genotoxic and non-cancer causing, non-mutagenic. Then comes clinical. Then we talk of clinical study. We know that if we have a product, Chavanprash based product called Swamla, we know it improves immunity. It's not just sense of well-being. It improves immunity by increasing the CD4 cell count. When we talk of iron deficiency anemia, it's not just increasing the hemoglobin levels. We say that it improves the iron stores, serum ferritin levels. So this kind of documentation and proof and publication we should have. And last, in this session, in next 15 minutes, what I would like to tell you, we know that how our products work. And this should be the trend. For example, if we talk of Asti Poshak tablets, we know how it works. I'll explain it to you. We have understood the mode of action, how it protects the bone. Then comes Vasant Kusumakar Ras. Sir gave an example of Suvarnamalini Vasant in diabetic retinopathy. The classical formulation, the widely used formulation is also Vasant Kusumakar Ras. We know how it works, how it helps in delaying the progression of diabetic retinopathy. I give an example. This is precisely when we talk of when we developed Amla Pitta Mishran suspension. First, when we read the text, okay, we want to treat Amla Pitta. But what is that Chikitsa Sutra? What are we looking at? So, the Chikitsa Sutra of Amla Pitta is Pachanam, Tikta Bahalam, Pathyam cha Parikalpayat. So, we have to treat this. This is the treatment principle. Now, to treat this, okay, this condition, this is the treatment principle. What is the formulation? Amla Pitta Mishran. Amla Pitta Mishranam tu Shauktik Tikta Bhuishtam. Jayed Amla Pitta Janyam Chardim Anna Vidhajam. What is important? Pachanam. Shauktik Bhasma has that pachan properties. We say Tikta Bahalam. The main ingredient is Bhunimbadikvat, which is Tikta Bahal. So it adheres to the Ayurvedic treatise or Chikitsa Sutra or principle of treatment. We have already standardized it. We have preclinical efficacy that it has anti-ulcer effect. It is safe, okay, in animal models. We have completed 2 clinical studies. One was the pilot clinical study where we proved that it is effective in endoscopic gastritis. It relieves redness in the stomach, erosions in the stomach. In the second clinical study, which is under publication, it was a multicentric 200 patient data. Last, what we are lacking or what we have planned now is, everyone knows that when we talk of acidity, what comes to our mind is proton pump inhibitors. We use rabeprazole, omeprazole. They know mode of action. It has that anti-secretory action and cytoprotective action. So we are studying, okay, Amla Pitta Mishran works, but now we have planned to understand how it works. Does it have anti-secretory action, cytoprotective action, or both? Then we can confidently say that our medicines, they work in the same way how Western medicines work. I'll cite some examples today. Now, before citing the examples, this was not just work of SDL. We collaborated with institutes all over India. And our first collaboration, international collaboration was with Sri Lanka, Kelaniya University, where we have completed or we are on verge of completing a project on Rajat Bhasma, where we will come to know how Rajat Bhasma works. And tomorrow, I think, Dr. Ketan, we are meeting Dr. Kamal Pereira. We are signing one more MOU where we will be studying some of our products in Sri Lankan population. So it is not a single-handed effort. We need collaborations. So we have collaborated with many institutes all over India, and Kelaniya University was the first institute. I mean, today's few slides, what I am trying to tell, okay, in bone and joint disorders, okay, what is this potential of Rasaushadhis? Then gynecological disorders, premenstrual syndrome is very common. It's very common nowadays. Then type 2 diabetic cardiomyopathy and retinopathy, in Parkinson's disease, and in aging associated neurocognitive decline, the clinical study which was done by Dr. Suhas Shetty. What is that outcome and what we can conclude from these studies? First, when we talk of osteopenia or osteoporosis, everyone knows osteopenia is the first stage. If we don't treat it, it develops into osteoporosis. But what is the burden? Global burden is very high. 1 in 3 female and 1 in 12 men, they suffer from osteoporosis. But who are the more sufferers? Females. Why? Because of menopause. Because of menopause, there is estrogen decline. More estrogen decline, more porosity of the bones. And women, they have menopause at around 50 years. Males, they have andropause at the age of 70 years. So who is the target audience? They are females, postmenopausal osteoporosis. And the beauty is, we know how the product works. Then comes osteoarthritis. Again, because of menopause, there is weight gain. Weight gain has direct impact on the weight-bearing joints, especially the knee joints. When we talk of osteoarthritis burden, all over the world, 85% of osteoarthritis cases are knee osteoarthritis. And it starts with weak knee muscles. It is mentioned in books, classical books. They say that initiation, progression, and severity of knee osteoarthritis is based on weak knee muscles. So we have to target muscle strengthening first. For that, we already used sesame oil-based products. We use physiotherapy. But ultimate end sufferer is cartilage. End sufferer is cartilage. When we talk of cartilage, what we can say, we require some DMOADs. Now I've given first example of our research, the first preclinical study, okay, which was done on Asti Poshak tablets. Okay, it's an osteoprotective agent. It was an ovrectomy-induced osteoporosis. We know that once we remove the ovaries, there is estrogen decline. Now, because of estrogen decline, there is weight gain. Now, in this publication, EMBA's index publication, what we saw, that the Ayurved intervention treated group, okay, the weight gain was very less. Because of estrogen decline, there is weight gain. But when we treated with Asti Poshak tablets and Ayurved intervention, weight gain was very less. See, because of ovrectomy, there was increase in 36% weight. But when we treated with Asti Poshak, there was 50% less weight gain. It means Ayurved medicines, they have estrogen-like action. They have estrogen-like action. Ultimately, after the treatment was complete, what we saw, we did bone mineral density in animals. When we did bone mineral density in animals, it was improved as compared to the ovrectomy-induced group. It means the product works, or the product has the potential. Now, this was followed by a clinical study in National Institute of Ayurved, Jaipur. Now, again, this publication, it is in international journal. Now, this study we had done in participants who were suffering from osteopenia, a stage before osteoporosis, okay, where BMD DEXA scan was done, okay. Now, when we talk of BMD DEXA scan, what is osteoporosis? Osteoporosis is T-score above minus 2.5. What is osteopenia? T-score between -1 and minus 2.5. What was the outcome? That, okay, this intervention for 6 months, the study was 6 months, it effectively improved the T-score of hip bone. At the same time, in addition to increasing the T-score, it reduced bone resorption in terms of reduction in serum osteocalcin level. So we know that our product, okay, it is not just calcium supplement. Calcium supplement will increase bone mineral density, but calcium supplement will never reduce bone resorption. So this is the beauty of Ayurved. We have ingredients which improve bone strength and which also minimize or control the bone loss. But how did it happen? How did the product work? Okay, our product is scientifically strong. In preclinical studies, we have proven that it works. In clinical study also, we have proved that it works. Now the question is, the Western doctors, they ask us, but how does it work? Now when we talk of how a product works, we did a cell line study. Now to understand the molecular mechanism of a product, we need to understand. Now, to understand this, how a product works, we need to understand a system which is called as Rankel rank OPG system. Now, when we understand this system, we'll know how a product works. What is basically Rankel? Now, everyone knows that when we talk of bone remodeling, there are two types of cells. One is an osteoblast and second is an osteoclast. Osteoblast is a bone building cell. Osteoclast is a bone repairing cell. Now what is rank? Now this bone building cells, okay, they basically secrete Rankel. What is Rankel? Receptor activator of nuclear factor kappa B ligand. Now this is Rankel. Now this is secreted by a bone building cell which is called as osteoblast. Now this Rankel, this is a protein. Now this protein binds to rank receptor on the bone damaging cell. But what is that bone damaging or bone repairing cell? It is called as osteoclast. Now when this Rankel binds to rank receptor, the repair mechanism, or what we can say, repair mechanism or damage mechanism starts. So Rankel, now expression of Rankel, because of menopause, because of estrogen deficiency, okay, there is more expression of Rankel. There is overexpression of Rankel. If this starts, I will explain you, or otherwise I will explain it in the similar way. So what is important? More expression of Rankel in females is because of menopause, because estrogen controls Rankel release. Now, because of Rankel expression, it binds to rank receptor on the osteoclast and there is more bone resorption. So, in the first 5 years of menopause, there is almost 20% bone loss. So, if we have to effectively treat post-menopausal osteoporosis, our objective is control Rankel. Otherwise, there will be an increase in risk of fractures. So, in this cell line study, we had used an animal osteosarcoma cell line. What is osteosarcoma cell line? It is UMR 106 cell line, bone cancer cell line, and it is seen that in bone cancers, there is overexpression of Rankel. Now, because of more Rankel, more bone damage, the same phenomena or pathological process, it happens in postmenopausal osteoporosis. So, what was the outcome of the study? The outcome of the study was your Asti-Poshak tablets. Okay, it works. It works because it controls the expression of Rankel. Now, this Rankel expression is very important. Why it is very important? Because Rankel expression will control the bone resorption. But we have to think out of the box. That okay, a medicine like Asti-Poshak tablets, it controls Rankel expression, it controls bone resorption, but it has additional repurposing benefits. What does it mean? Now, when we talk of, I was going through Sri Lankan data, 25% of cancers in Sri Lanka are breast cancers. The biggest benefit in Sri Lanka is, as compared to the world, the education level. They diagnose it fast. Now, when we talk of breast cancer, in breast cancer also, there is overexpression of Rankel from tumor formation to secondary metastasis. So, this Rankel is very important. How repurposing is very important. Asti-Poshak tablets, it controlled the Rankel secretion. It is protecting the bone. But if you give it to a breast cancer sufferer, okay, it will increase the efficacy of anti-cancer drugs because it has the potential. It has the potential to reduce the Rankel expression. And this is what we have proved. This is what we have proved in our this preclinical experiment. Now, in our body, in addition to Rankel expression, okay, our osteoblasts, they also have a chemical called as OPG, a protein, OPG, which is osteoprotegerine. I think it has started. Okay, this is what I was trying to explain. I will not repeat it. This is an osteoblast, bone building cell. It secretes Rankel, which is a protein. This protein binds to osteoclast progenitor cells. Whenever Rankel binds to rank, the damaging process will start. So what is the objective of the treatment? We have to stop Rankel from binding to rank. And this is what Asti-Poshak does. So if you ask me how your product protects the bone, okay, we say, sir, our product protects the bone by reducing the overexpression of Rankel, especially in postmenopausal women. Why? Because in postmenopausal women, because of estrogen deficiency, there is overexpression of rank. When we say, okay, we have additional advantage, we don't just protect the bone. Okay, we are useful in cancer treatment also, because when we talk of bone cancer or breast cancer, this Rankel control is very important. This is the last slide for this topic. Okay, when we talk of Rankel expression, now in Rankel expression, okay, we saw that it controls bone resorption. Okay, what we saw, that this product also improves bone biomineralization and remineralization. Because when we talk of bone resorption, there is a chemical or a protein called in our body called as alkaline phosphatase. Now, when we talk of alkaline phosphatase, it provides inorganic phosphate, which is essential for formation of bone slurry. Now, this is a very important slide. In this UMR 106 cell lines, this is untreated cell line. This is a cancer cell line. Obviously, it has more Rankel expression. When we treated it with a special dye called as alizarin S dye. Now see, this is control cell line. This is also cancer cell line treated with Asti-Poshak. When we treated it with alizarin red assay, which is considered a gold standard. What we found out, that there is a complex which is formed, which is called as ARS-CA complex, alizarin calcium complex. This gives an indication that bone mineralization process has started. Okay, bone building has started. But when we completed this clinical study, we also saw that it reduces sandhi shul, kati shul, asti shul. So we thought that, okay, in addition to osteoprotective effect, it also reduces sandhi shul. So does it have any role in osteoarthritis? So we said that, okay, we will design one more study. We'll design one more study and we'll find out whether it protects the cartilage. So what did we do? We did a simple study because clinical study was already available. We did a simple study, a preclinical study in experimental model of osteoarthritis. In Vista rats, we injected a chemical which is called as monosodium iodoacetate, which triggers cartilage loss. Now, if you see this picture, this eye-shaped, these cells, these are chondrocytes. They make up our cartilage, because after cartilage layer, when it becomes hard, bone starts. We call it subchondral bone. So what maintains cartilage health are two important chemicals or proteins. First is MMP13, matrix metalloproteinase 13. And both these proteins, second is COMP, cartilage oligomeric matrix protein. Now both these proteins, they are secreted by the chondrocytes. Whenever there is cartilage damage, these proteins are expressed. Now, especially MMP13 is an cartilage, it's an catabolic factor, whereas COMP, it is responsible for integrity of the cartilage. Whenever cartilage is damaged, these proteins are overexpressed. When we studied Asti Poshak, again this paper is under publication. Anyway, we'll start. So what we saw, that Asti Poshak treatment, it reduced the expression of MMP13 and COMP. What does it indicate? Okay, it has that disease modifying effect. I had used one word called as DMOADs, disease modifying osteoarthritis drugs. The Western medicines, they only provide symptomatic relief. They just give pain relief. No. When we talk of Ayurved, we talk of cartilage protection, which is the root cause, which is root cause in osteoarthritis. So for cartilage protection, we have proven that it definitely has an edge. So Asti Poshak, in addition to improving bone health, it also improves the, when we talk of one more indication, majority of women, they suffer from premenstrual syndrome. Now premenstrual syndrome, what I have heard in US, it is one of the major cause of divorce. It is one of the major cause of suicide also. Now premenstrual syndrome goes unnoticed. Now when we talk of premenstrual syndrome going unnoticed, why Ayurved can help? Because the data generated in last 10 years, what it says, that in premenstrual syndrome, calcium works. Calcium supplements, they can reduce the physical as well as psychological symptoms. So we got a lead that if Asti Poshak offers natural calcium, will Asti Poshak work? So again, this is a CTRI registered study. We have completed this study in Parul University, Gujarat, and this paper is under publication. What we saw? We saw that Asti Poshak tablets are effective in offering relief in premenstrual syndrome in 2 continuous cycles. And in the 3rd cycle, where we did not give any treatment, there was maintenance of relief. Now we are taking it further. Now why? Because this problem is basically a luteal phase problem. Immediately after ovulation, before menses come, 10 days before the menses, in the luteal phase, women suffer this and they suppress the symptoms because they don't know what they are suffering. And here we had used some very good scales. One was PMTS-O and PMTS-SR. What is PMTS-O? Is premenstrual tension syndrome observer rating scale, and second was premenstrual tension syndrome, self-rating scale. The observer rating was similar to self-rating. It means correct assessment was done. And so these are some international scales which were used and where we found out, okay, that it helps. Calcium in Asti Poshak could reduce somatic symptoms. And when we see calcium is not just bone health, we have extracellular calcium also, which is responsible for passing on the nerve impulses. This is what happens in the luteal phase. So Asti Poshak works here also. Now when we talk of diabetic cardiomyopathy, again this is a killer disease. Globally, the percentage, or what we can say the burden of diabetic cardiomyopathy is 32%. And the burden of diabetic retinopathy is 26%. So this is a bigger killer. But exactly what is diabetic cardiomyopathy? Diabetic cardiomyopathy is weakness of the heart muscles. There is calcium deposition in the heart muscle. Ultimately, as in clinicians, what we look, ejection fraction goes down. Ejection fraction goes down. And what is the differentiating factor? Diabetic cardiomyopathy, he does not have blood pressure, he does not have arterial disease, coronary artery disease. It is excluded. Now, why this happens? This is basically insulin resistance specific to the heart. So we had studied Vasant Kusumakar Ras. Now this paper has been published 2 months ago. And this has been published in impact factor 3.2. We said that Vasant Kusumakar Ras, okay, has the potential to minimize the risk of diabetic cardiomyopathy. Why it is very important? There is an important landmark study, a Framingham study, which says that if people are diagnosed with diabetes, women have 5 times risk of dying of heart failure and males have an 2 times risk of dying by heart failure. And this is an underappreciated disease, no treatment. Only treatment is you control your blood sugar levels. So if medicines like Vasant Kusumakar Ras, they can minimize the risk of cardiomyopathy, okay, and which has been proven, it is a win-win situations for us. And in this study we have proven. But how does it work? I was talking of molecular mechanism. What happens in diabetic cardiomyopathy? There is not enough energy which reaches the heart. What is the meaning of energy? Glucose. Glucose does not enter the cardiomyocytes, which make the myocardium. So cardiomyocytes die. When cardiomyocytes die, okay, there is influx of calcium in the heart muscle, which causes stiffness, ejection fraction goes down. Now, Vasant Kusumakar Ras ensures that insulin signaling is restored. How insulin signaling is restored? It improves the PI3K, AKT, GLUT4 signaling pathway. Now this GLUT4 is very important. What is GLUT4? Is glucose 4 transporter. Now this glucose 4 transporters, 70% of glucose or energy to the heart muscles is provided by them. So this is very important, and Vasant Kusumakar Ras does this effectively. This is what we have proven in this paper. Next is Vasant Kusumakar Ras in diabetic retinopathy. I think sir had already told the diabetic retinopathy, okay, first stage is non-proliferative. Then comes the proliferative stage of diabetic retinopathy. Again, this paper was presented in Washington DC, a very prestigious conference which is called as ESPET. See, these images are very important. This is the vehicle control. This is the normal fundoscopy. This was a preclinical study. If we see this diabetic control, we see lot of red lines. What are these red lines? These are new vessel formations, neovascularization, okay, or we call it angiogenesis. This is a sequel of diabetes. Now, in Vasant Kusumakar Ras, if that red lines or new vessel formation is very less, it means Vasant Kusumakar Ras, if taken along with the supporting anti-diabetic medicines, it can reduce or protect the retinal tissue. Now, this is very important. This is called as diabetic paradox. See, there is more formation of blood vessels in the eye in retinopathy, whereas in diabetic wound, there is less formation of blood vessels. So, we should try Vasant Kusumakar Ras in both these conditions. And the latest treatment in Western medicine is anti-VEGF therapy. What is VEGF? Vascular endothelial growth factor. These injections are given every 3 months directly into the eye. Now Vasant Kusumakar, this vascular endothelial growth factor, if they are expressed more, there is more blood vessel or angiogenesis in the eye. Vasant Kusumakar Ras is an Ayurvedic anti-VEGF therapy. And this paper again, it got a prize in Washington DC. Next. Now, last 3 or 4 slides. We are talking of Parkinsonism. Again, mode of action. This study was published. It is on Suvarna Bhasma. When we talk of Parkinsonism, Parkinsonism is a part of what we can say neurocognitive disorders. Number 1 is Alzheimer's disease. Second is Parkinson's disease. What happens in Parkinson's disease? We know as clinicians, clinical features are, okay, the gait becomes very slow, no? Patient is, second is there is muscular rigidity. Third is there are tremors at rest. Why this happens? Because in midbrain, there is an area which is called as substantia nigra. Okay. It has that dopaminergic area. It has dopaminergic neurons which produce a chemical which is called as dopamine. Whenever there is less dopamine, these symptoms will happen. So what we have seen here, that last group, Suvarna Bhasma treated group, okay, the dopamine loss was very less as compared to untreated group. It means that it has that neuroprotective effect. Again, this paper has been published in a very, I think this impact factor is 2.2, that Ayurved, Suvarna Bhasma can protect the neurons, okay, and maintain, or it does not cause the dopamine levels to go down. This is the repetition of the work done by Dr. Suhas Shetty sir, this publication. We talk everyone is aging. Now see what the data say. By 2030, 1/6 of the world population will be above 60 years. But the first line, as we age, after the age of 40 years, every decade there is a decline, shrink in brain weight and brain volume by 5%. So anyway, if some of us are 50, it means we have lost 5% of our brain. Yes, so this is aging. Now when we talk of, this ultimately leads to neurocognitive decline. And in Western medicine, there is no medicine for mild neurocognitive decline. The medicines which they use are for last second, severe neurocognitive decline. When we talk of neurocognitive decline, there are 4 main diseases. First is Alzheimer's, 70%, not Alzheimer's. First is, see I forgot the name. First is, yes, Alzheimer's disease, 70%. Second is stroke, vascular dementia, it is 10 to 20%. Third is Lewy body dementia, which is 2 to 3%, and remaining types of dementias. It is frontotemporal dementia. So here in this study, what we found out, we had taken cases of mild neurocognitive decline treated with Medha Sagar Ras for 2 months. And the scale which was used was MOCA, Montreal Cognitive Assessment Scale. Now, this Montreal Cognitive Assessment Scale, basically, okay, it covers cognitive dysfunction in terms of memory, concentration, okay, daily we say executive functions, okay, it also covers language and conceptual thinking. So the total score in MOCA, okay, normal is 26 and above. We had taken mild cases between 18 to 25. What did we found out? There was no progression in 2 months. In fact, with 2 months treatment, 2 tablets at night, there was improvement or stabilization of the cognitive functions. Along with this, we also observed improvement in sleep and reduction in anxiety. Here we had used Pittsburgh Sleep Quality Index, and secondly we had used Hamilton Anxiety Rating Scale score. So what is the crux of the matter? Evidence is required, because this is an era of evidence-based medicine. Okay, we are doing sufficient clinical studies, but some of our time, energy, we should also spend on understanding the mode of action. See, we can confidently say that our Asti Poshak works by reducing the Rankel expression. Our Vasant Kusumakar Ras, okay, protects from diabetic retinopathy by reducing the expression of VEGF. Or our Vasant Kusumakar Ras protects from cardiomyopathy by increasing the expression of GLUT proteins. Our Suvarna Bhasma works in Parkinsonism by stabilizing or non-deteriorating the levels of dopamine. Thank you.
Thank you very much, sir, Dr. Mukesh Chawda, for sharing of the valuable insights on the mode of action of Rasaushadhi for the 7th edition of Rasashastra Sambhasha. And to felicitate Dr. Chaudhary, I respectfully invite the co-chair of this forum, Professor Ms. K.R. Veerasekara. Madam, please be the presentation party to felicitate Dr. Chaudhary. Ladies and gentlemen, please share a big round of applause for sharing insights on valuable preparations of Rasaushadhi Sri Dhootapapeshwar Limited, exceeding 150 years, counting 153, felicitating every aspect of Ayurveda with proper manufactured drugs. So Dr. Chawda clearly explained what the company does to the betterment of Ayurveda.